from the province shows that if we don't all commit to restrictions, it could get a lot worse. Like tripling new daily cases by next week. See the red line? That's if we don't change. The blue line is where we need to be, at 40% of pre-COVID activities. Top Dr. Bonnie Henry says the worst case is avoidable.
Models give us a sense of what are the parameters that are most important going forward. It's not a prediction. It's not a prediction that we're going to have 3,000 cases next week. And we've not seen that happen in other models that have presented in the past. It helps us look at what are the things that we need to adjust and where we need to go with those. So, we've put in additional restrictions. People are paying attention.
She's not adding more restrictions, but reminding people to stick to 10 maximum, the same 10, and wear masks if close together, even if outside.
It's about finding those ways to do it more safely. There's no zero risk right now. We're seeing this virus being transmitted in lots of places, but we know that the order is about indoor gatherings because those are the riskiest settings.
Schools have had the spotlight of concern for many, the latest numbers showing worst fears not playing out.
We've not seen increased transmission in the school environment. Again, it talks to the importance of safety measures and structured environments being less risky than some of the unstructured social connections that we have.
Though most in-school transmissions have been kids catching the virus, studies showing there have been relatively few. 55 in Vancouver Coastal Health before Christmas. Then in Fraser Health, Christmas to spring break, 267 in just 15% of their schools. This is the data many have been waiting for.
Families are saying that they don't have enough information about what's happening in schools to make informed decisions about their children's safety. And so, this provides some information in, I would say, only in Fraser Health, the Fraser Health Authority, really. And so, my hope is that we're going to get more timely data because I'm not sure this is going to put people at ease, and it should.
But with variants in the majority now, 60% and growing, half of those the more transmissible P1 variant, Mooring echoing what Dr. Henry says, there's no room for error.
When the variants in particular get a foothold in some of these communities, they spread rapidly because people just aren't thinking they're as at risk as Vancouver, where you see people, in the streets wearing masks all the time.
For City News in Victoria, I'm News 1130's Liza Yuzda.
Another big delivery delay from Moderna.
We're fully aware that provinces are making adjustments